Hello, dear aspirants. Welcome everyone to Master Nursing classes. So, in the today's class, we are dealing again the very important sessions on the OBG. So, the OBG classes till 10 to 15 classes will be there for you all. So, among these 10 to 15 classes, I am trying to cover the whole subject of the OBG. Okay, that is very important for you all. Okay, yes, bacho. So, whatever the studied from day one to here, this is the very basic of the OBG. From the tomorrow session, yes, the very important content it will be coming in front of you all, okay, including the today's session. It will be very helpful. So whatever we have studied this many days is the only a basic of the OBG. So in the RRB, the basics of the OBG will be many questions it will be coming, okay. So from the tomorrow onwards we will be studying the advanced questions on the OBG, okay. That is very much helpful for you all, okay. So definitely each and every session will be giving a particular 1 to 2 marks in your every exams, okay. So stay connected with the master nursing classes. So there is very important things and lots of the thing are there to talk on the OBC, but I am delivering those very important content that may ask in your exams, okay. So yes, I don't want to overload you all, so I am giving the precise content that is helpful for you all, okay. So yes, a very happy new year to every master nursing classes member. Yes, very happy new year to you all. Happy new year. Yes. So bachcho, so on this particular 2025 years, so God will grace you all with a good central government job and order copies to join the any central institutes. So this is a prayer from my side to the God. Okay. So if you are really working hard, so God will pay the, yes, God will pay the things what you have deserved for. Okay. So yes, always believe on your hard work, always believe on your consistency. That is the key to success, students. Okay. So hope this 2025 years becomes yours and everything will be easy and better in your life. Okay. Yes, Bachcho. Thank you so much for your warm wishes and happy new year to you all. Okay. Yes. So can we start the today's class, Bachcho? Can we start the class? Yes. So without wasting the time, we will start the class of this today. So here is the first question in front of you all. So do read the question carefully and try to give the best answer. Okay. What is the purpose of the administering the corticosteroids to a pregnant woman? Okay, who is at the risk of the preterm delivery? Okay. So what is the purpose of the administering the corticosteroids to a pregnant woman who is at the risk of the preterm delivery? Option A is telling that the promote the brain growth. Option B is telling that the is to promote the fetal lung maturity. Then option C is telling that the to reduce the risk of the fetal infection, and option D is telling that the to induce the labor. Okay. So what is the correct answer for this question? Yes, very nice of you all. Okay, who all are giving the option B as a correct answer? That is the perfect answer for this one. Okay, so that is the perfect answer. Okay, to promote the fetal lung maturity, we have to give the yes corticosteroids in a preterm delivery only. But so in the yesterday's class we have dealt that very importantly. Yes, when the when surfactant will produce us. Okay, when surfactant will start to produce, when the surfactant will start to produce. Yes, can anyone able to tell? Very nice. Okay, in the yesterday's class only we have dealt the surfactant will start to produce on the 24 week of the gestation. Okay, so when the surfactant will come to the amniotic cavity, yes, when the surfactant will come to the amniotic cavity, yes, that is to the 32 week of the gestation, it will come to the amniotic cavity. Yes, we have dealt this one. Yes, already studied. Okay, so when it will be coming to the our lungs of the fetus. Okay, when the surfactant will be coming to the lung of the fetus. Yes, on the 34 week of the gestation, it will comes to the lungs of the fetus. But so if the question is coming when the fetal lung will get mature, so your answer would be that is the 34 week of the gestation. Yes, the fetal lung will get mature. Okay, so if in case the preterm delivery which is less than 34 weeks means the fetal lung is immature. Is that clear? Bacho, listen once again. When the surfactant will start process, so this is the 24 weeks. Many time asked question. Okay, so when it will be entering in the amniotic cavity, surfactant on the 32 weeks. Again, many time asked question. So when it will be entering the pulmonary cavity or to the lungs, when the surfactant will be entering in the lungs, that is the 34 weeks of the period of the gestation. Okay, in the pregnancy on the 34 week, so the surfactant fluid will enter into the, yes, the fetal lungs. So after entry of the surfactant fluid in the fetal lungs only, fetal lungs will get mature. Okay, what in case the delivery or the labor begins less than 34 weeks. Bachcho, if in case labor, okay, which begins less than 34 weeks, less than 34 weeks means always give the steroids. Always give the steroids. Okay. Always give the steroids to the mother in order to promote the fetal lung maturity. Okay. So in the steroids, we are giving the two drugs, that is the betamethasone, okay, and dexamethasone, okay, and dexamethasone. So these are the two very important steroids we are giving to the pregnant woman. So previously, dexamethasone was using more in the clinical settings, but nowadays the betamethasone is the mostly used drug. Okay, so now most common is the, okay, now the most common drug using in the clinical setting for fetal lung maturity is the, that is the betamethasone. Okay, previously it was dexamethasone. Now it is the betamethasone. Hope the concept is clear. Okay, so labor process if begins less than 34 week means, yes, the surfactant which didn't enter the lungs means the lungs are completely immature. So to promote the fetal lung maturity, we have to give the steroids. Hope the concept is clear. Okay, if in case the labor process begins after 34 weeks, okay, so after 34 weeks means you have to do the, yes, the fetal lung maturity test. Okay, fetal lung maturity test you have to do. Okay, if in case in the fetal lung maturity test we have dealt yesterday, yes, in detail, that is the one is the bubble test, another one is the, yes, which one, what we have dealt yesterday, one is the bubble test, another, very nice, that is the sphygmomyelin to elastin ratio, another one is the, yes, Nile blue sulfate test. Bachon clear? Yes, in the Nile blue sulfate test, yesterday people were commenting that that is the orange color cells. Yes, bachon, orange color also correct and pink color also correct. In some books they have given brown color also, but you have to consider primary answer as a pink. Okay, if in not in pink, so you can give the orange color also correct answer. No worry. Okay, no worry about it. If both color in options, what to do? If pink color or orange color. Okay, there is very rarest condition like the examiner will he will confuse the students, but always primary answer will be the pink, then you have to go give the orange color also, that is no problem. So okay, in some books it is given the orange, in some book it is given the pink. Okay, in some books like in competitive books only they have given brown color also. No need to worry. Okay, so I am talking about this test. Okay, what I have like yesterday we have studied this one. Okay, there is the Nile blue sulfate test. So when the Nile blue sulfate, it will mix us with the amniotic fluid. Okay, so if in case in the amniotic fluid the surfactant will be there means this Nile blue sulfate will get react with the amniotic fluid and it may give the pink color. Okay, so it may give the orange color also. Okay, this may give the orange color also. So yes, the primary answer is the pink because this is in the standard book. Okay, so secondary answer is the orange color. Okay, so if only one answer you can choose the orange color also, no worries. Okay, so examiner will not confuse on these situations here because it is the microscopic. Okay, so this is the microscopic, in the microscopy we can't decide like completely this color only. Okay, so hope you people have used the microscope in your like PUC and all. Okay, clear bachcho? Yes, very nice of you. Okay, so this is the very basic. And so what I am telling here, so I am telling here, okay, so if in case the labor is less than 34 weeks, use the steroids. If it is more than 34 weeks, okay, so let me write here more than. Okay, I have written 34. Okay, if it is more than 34 weeks, okay, so then always you have to do the fetal lung maturity test. If it is a fetal lung is immature, then you can give the steroids. Otherwise, no need of the steroids after 34 weeks. But so clear? Very nice of you all. Okay. Yes. Yes. So hope the concept is clear for this question, and the answer for this one is the option B. Okay. So again, one more thing you have to remember. Okay. So to promote the brain growth. Okay. To promote the brain growth, so you have to give the MgSO4. Okay. That is the magnesium sulfate. Magnesium sulfate is a drug also used in the severe preeclampsia or eclampsia. Okay, in order to prevent the seizure. Okay, this is the potent cerebral or the central vasodilator. This is the potent central vasodilator. Okay, means it will dilate the vessels of the brain. Okay, so it provides the perfect blood supply to the brain. So MgSO4 is used to give the, yes, the brain growth, used to promote the brain growth. So that is the very important. Always you have to remember. Okay, we can't use steroids to promote the brain growth. Okay, and if you are using the corticosteroids or any steroids, okay, it will not reduce us the risk of the infection. So always remember steroids. So side effect of the steroids, side effect of the steroids increases the infection risk. Okay, increases the infection risk. Okay, so always if the patient on the yes IV steroids, keep him in the positive pressure ventilation room. Okay, so keep him in the positive pressure ventilation room. Okay, yes, very important. What is the positive pressure ventilation room? So students, there are two type of the rooms, that is the negative pressure ventilation room and the positive pressure ventilation room. So we have to consider this is the positive pressure ventilation room. Okay, so this is the negative pressure ventilation room. Okay, so in the negative pressure ventilation room, consider this one is the door and here is the patient. So this patient is infected. In the negative pressure ventilation room, the patient who is inside, he is infected. So we don't want the air, okay, that is exhaled by this patient to go out. So we creates the negative pressure here, means the air it will be, yes, the air it will be exhaled by the patient will be directly exhaled by a port which is like directly connected to the outside. Okay, with the port which is having the HEPA filters. Okay, so high because the air will coming from the outside to inside in the negative pressure room. Okay, it will circulate here and the patient will use this one. So and patient will exhale. Okay, the patient exhale room will be go by the exit ports. So exit ports contain the, yes, the HEPA filters. Okay, is containing the HEPA filters. So this HEPA filters, so it will filters the microorganisms which is exhaled by the patient, and again, so the fresh air it will go to the environment. So this is the negative pressure ventilation room. So what happens in the positive pressure ventilation room? In the positive pressure ventilation room, the person who is inside, okay, the person who is inside is not infected, but his immunity is low, he is prone to get infected. So we don't want the outside air from the hospital to enter here, because the hospital's air we will always consider as the infected air. Okay, so the hospital air we don't want to enter into the patient, because the patient on the immunosuppression therapy, the patient on the corticosteroid therapy. Okay, so that is what the patient who is on the immunosuppression therapy or corticosteroid therapy. So always we will create the positive pressure in the room, means whenever we will open the door, the air will enter from the patient room to outside. It will not sucks the air from the outside to inside. Okay, so this is what we call the positive pressure ventilation room. Okay, yes, bachon, clear? Yes, clear. Very nice of you all. Okay, so the patient who is on the corticosteroids therapy, we have to keep always him on the, yes, positive pressure ventilation room in order to prevent the infection. Okay, so here patient is infected, we are protecting the others from the patient, but here the patient is immunosuppressive, we are protecting the patient from the others. This is a, yes, this is the basic uh, difference between the positive pressure and negative pressure ventilation room you have to consider. Okay, so again steroid. So steroid is very dangerous, students. Why? Because it is increases the risk of the infection. So second best point. Okay, so always remember steroid. Okay, it increases the osteoporosis risk. Okay, steroids you are giving means it is causes the osteoporosis. Okay, how means it causes the osteoporosis risk. What is the osteoporosis? Osteoporosis means decrease the density of the bone. Okay, decrease the density or mineralization of the bone. Okay, so that is what we call the osteoporosis. If you are giving the steroids, okay, so it will demineralize your bone. Okay, the minerals which is coming, which is already there in your bone, it will comes out. Okay, so the minerals which is coming out means the density or the strength or the, yes, the strength of the bone is getting decreased, means the bone will get, the bone will get more fragile to fracture. Okay, bone will get more fragile to fracture. So the long term corticosteroid therapy which will cause the, yes, the osteoporosis. One more very important point, remember. So osteoporosis will causes the, yes, hyperglycemia. Okay, what it causes the, it causes the hyperglycemia, means it increases the blood glucose level. Okay, it increases the blood glucose level. Okay, and again one more important, if in prolonged use of the corticosteroid therapy, okay, so it may leads to the Cushing's disease. Steroid used Cushing disease will be there. Okay, so Cushing disease, in the Cushing disease there is the increased, yes, glucocorticoids. Okay, so externally we are giving the glucocorticoids or the steroids, means again it leads to the Cushing's disease. So these are the very important four points they can ask in the exams on the steroids. But so whatever we have studied here is the very important. To promote the fetal lung maturity, we have to give the steroids in the mother. Yes, so that is very important. To promote the brain growth, MG is very much necessary. Steroids increases the risk of the infection. Okay, so because of that, steroid increases the risk of the infection. Because of that, we have to keep the patient who is on the IV steroids in the positive pressure ventilation room. Okay, so in order to protect the patient from other infected patients. Is that clear, bacho? Clear. Okay, so here's the steroids causes the osteoporosis and it makes the bones to get more fragile. So nursing intervention here is the move the patient slowly while shifting the patient from the bed to chair to bed. Okay, so high because the bones are more fragile to get fracture. Okay, so and some fall risk education also we have to give to the patient who is on the steroids therapy. Okay, means not on 1 to 2 days steroid therapy, the long term steroid therapy I'm talking about. Okay, so next the steroids causes the hyperglycemia. Again, increased glucose means the bacteria will love to eat the glucose, means there is increased bacteria in the blood. Okay, so again it increases the risk of the infection. So okay, steroids also causes the hyperglycemia and it may causes the Cushing's disease. Okay, if there is long term steroid use, means it may also causes the over or abused or overused steroid Cushing disease. Okay, so this is a very important, you have to consider in your mind. Okay, so the lots of questions we have studied on the single particular question. Okay, that may be helpful for you all in the upcoming exams. Okay, yes, so induction of the labor and augmentation of the labor again I will deal in the next class. Okay, don't worry. So this is what I have studied. I have told the criteria to give the steroids. Okay, so here is the next question. So at what gestational age is corticosteroid therapy is typically initiated for the fetal lung maturity? बच्चों fetal lung maturity के लिए when we have to give the corticosteroid therapy. Yes, what is the exact timing recommended by the, yes, what is the exact time recommended to give the corticosteroid therapy to promote the lung maturity? I'm waiting for your answer in the comment box, बच्चों. So I will eliminate the option which is making confusion for you all. Okay, so that is option B is not correct answer. 24 to 28 weeks. So we can't give the corticosteroid therapy. Okay. Yes, the exact time to give the corticosteroid therapy is that is 28 to 34 weeks. Just here only I have said, bachcho, at the 34 weeks, the surfactant will comes to the lungs and it will get matures the lung. Okay, so here option D is telling, few of you are giving the D answer. So already it is 34 to 36 weeks, means the surfactant came here and lung maturity happened here already. Okay, so if in case the preterm delivery, okay, it is before 34 weeks, before 34 weeks, always give the steroids. Okay, always give the steroids. Okay, after 34 weeks we have to do the fetal lung maturity, then if it is immature, then only we have to give the steroids. Okay, which are clear? Okay, so that is the very important and always best recommended time to give the corticosteroid therapy to promote the fetal lung maturity. It may directly comes in your exams with same options. Okay, bachcho, so remember this is the best recommended time, that is the 28 to 34 week is the best recommended time to give the corticosteroid therapy. Okay, yes, to initiate the fetal lung maturity. Bachcho, so how much times it will takes? Okay, so today I have given the betamethasone. Okay, so I have given the betamethasone to the patient. Okay, intramuscularly today I have given. So how much time it will takes to act? Yes, very much important. This is also question they will ask in the exams, that is the 24 hours it will takes to act. Bachcho, very important. This is the, yes, the 24 hours they will take, the steroids will take to act to promote the fetal lung. Okay, to promote the fetal lung maturity. Hope the concept is clear. Okay, yes, so after giving the 34 after giving the steroids we have to wait for the 24 hours. Okay, so then it will help for the fetal lung maturity. So this is the ideal time to administer the steroids. Okay, so here's the next question. This is also very important and simple question. Okay, So what is the typical dose of the beta-methogen for the fetal lung maturity? So this may also directly comes in your exams with the same option. Okay. So bachcho, as it told, yes, can anyone able to give the answer for this one? So anyone is ready to give the answer for this one? Yes, fatapat do comment in the comment box. Yes. Yes, you people were confused about the route or else dose. So just comment if people were confused about the route or dose. Yes, I will give the clue. Bachcho, yes, I will give the clue. That is the intramuscular is the route we will use. Okay, IV we can't give. Okay, so to promote the fetal lung maturity, how the steroids are given with which route? So intramuscularly we will give. Okay, nice. So then give me the answer. Yes, very nice, very nice. So the answer for this question is the yes, the total dose of the betamethasone for the fetal lung maturity is the total dose they have asking. Yes, that is the 24 mg. Okay, so bacho, very important. So remember the dose schedule for the betamethasone. Okay, so very few area where the dose will asked in the exams. Okay, so this is also very important related to the dose. Why? Because so it will different from the different drugs. Okay, so in order to promote the fetal lung maturity, we are having the two steroids. That is the one is the betamethasone and one is the dexamethasone. Okay, so this betamethasone will give 12 mg, then we have to wait for the 24 hours, then we have to give the 12 mg. Okay, so this is the total 12 mg plus 12 mg, that is the 24 mg is the dose. Okay, with the 24 hours gap. But in the dexamethasone, yes, one student already commented the answer. Okay, in the dexamethasone 6 mg, okay, wait for 12 hours, then give the 6 mg, then wait for 12 hours, then give the 6 mg, then wait for 12 hours. Okay, then give the 6 mg. So we have to wait for 12 hours in each and every dose. Okay, bachcho. So dexamethasone total how many dose will be given? Okay, 1, 2, 3, 4. Four dose of the dexamethasone are there with 6 mg, 6 mg, 6 mg. Again the total doses. Again the total doses 24 mg. Okay, again the total dose is 24 mg. Here also total dose is 24 mg, but the dexamethasone 12 mg with 24 hours gap, again 12 mg. Okay, after giving the last dose, after giving this last dose, we have to wait for the 24 hours for promoting the fetal lung maturity. Okay, that is the very basic you have to understand. Okay, bachcho, clear about the dose. Okay, so and the route I have told already, that is the intramuscular always preferred route. So they have asked betamethasone here for fetal lung maturity 6 mg intramuscular, then again 6 mg intramuscular. Okay, again 6 mg intramuscular, again 6 mg intramuscular with 12 hours gap. Okay, with 12 hours gap, right? So this is the dose schedule of the dexa. Okay, so this is the dose schedule of the dexamethasone, right? So 12 mg IV is not used. Okay, so 12 mg IV is not used. So this is the not a dose schedule. So 24 mg intramuscular, that is the 12 mg, then gap of the 24 hours, then 12 mg. This is the exact dose schedule of the betamethasone. So option C goes the correct answer here. That is the 24 mg intramuscular. Route is always remember. Route is always remember whether it is the dexamethasone, whether it is the betamethasone. That is the intramuscular is the route. Bachcho, clear? So whatever the topic I have given on the steroids here in the OBG, there is highest chance to come the questions. Very importantly, it may comes with the same option 60%, but the 40% I am sure that the questions will coming from the concept I have explained. Okay, so keep the concept in your mind. So do approach to the exams, give the best shot. So in front of the examiner, so the result will be very clear. Yes. So hope the concept is clear on the steroids. Bacho, yes. So can we quickly revise the steroid? Okay. Yes, the steroid is the corticosteroid given to promote the fetal lung maturity. Yes. When will the surfactant will be coming started to produce? That is the 24 week. When it will comes to the amniotic fluid, 32 week. When it will comes to the fetal lung, that is the 34 weeks. Okay, so if the labor initiated before 34 weeks, always give the steroid. Okay, so two steroids we are using, dexamethasone, betamethasone. Okay, and if it is more than the 34 weeks, always do the fetal lung maturity. If it is immature, then only use, otherwise no need. Why? Because at the 34 weeks already surfactant came and fetal lungs are get matured. Okay, so if only necessary, then use the steroids after the 34 week. Otherwise, no need of the steroids after the 34 week. Clear, bacho? Clear. Okay, so this was the dose schedule on the corticosteroid therapy. Okay, if it was, sorry, this is the exact ideal time to give the corticosteroids to the pregnant woman. Okay, that is the 28 to 34 weeks. Okay, so how much the time required for the steroids to act? That is the 24 hours. I have highlighted in the red. So these questions may comes with directly. So the best route to give the steroids in the pregnancy to promote the fetal lung maturity, that is the intramuscular. Okay, bachon clear? So this is the dose schedule on the steroids. That is the, yes, very importantly, betamethasone 6 mg. Betamethasone is the total 24 mg. That is the first dose is the 12 mg, then 24 hours gap. Second dose is the 12 mg. Okay, bacho, then the dexamethasone, that is the 6 mg, 6 mg, 6 mg with total 4 dose with 12 hours gaps. This is the very basic you have to understand. Okay, so here was the dose schedule. Bacho, clear? Clear. So here is the next question in front of you all. So do read the question properly and give your best to best answer in the comment box. Yes. The question is very simple. At 36 week of the gestation, the fundal height is expected to be. So where will be your fundal height? Yes, bacho. At the 36th week of the gestation means the mother is 36 weeks now of her pregnancy. So now where is the fundal height is? Option A is telling that it is at the level of the symphysis pubis. Option B is telling that it is the midway between the umbilicals and gypoid process. Option C is telling that at the gypoid process. Yes. Option C is telling that 4 centimeter above the umbilicus. So I want to answer for this question. Bacho? Yes. At the 36 week of the gestation, it is at the level of the, very nice of you all. That is the option C is the correct answer, and almost all you people given the correct answer. So this is the correct answer. Yes, at the 36 week of the gestation, it is expected to be at the level of the gypoid process. Okay, so if the question is like this, at the level of the symphysis pubis, when it will be at the level of the symphysis pubis, when it will be at the level of the symphysis pubis at the 12 week of the gestation, and so midway between the umbilicus and gypoid process. If it is, okay, 1/3 midway between the umbilicus and gypoid process, so it is as 30, sorry, it is at the 28 week of the gestation. And if it is 2/3, okay, between the midway of the gypoid process and the umbilicus, means it is the 32 week of the gestation. Let me give a clarity here, bacho. So here is the diagram. Okay, for your better clearance I will draw and teach you. Okay, don't worry. So consider this one is the symphysis pubis. Okay, so this is the abdomen of the mother. This is the abdomen of the mother. Yes, this is the umbilicus here. This is the gypoid process here. Okay, so this one is the symphysis pubis. Okay, bacho, if examiner is asking the question, so when the height of the uterus at the level of the symphysis pubis or just above the symphysis pubis, he will ask. If it the question just above the symphysis pubis or at the level of the symphysis pubis, your answer will be at the 12 week. Okay, at the 12 week, it is at the level of the symphysis pubis or just above the symphysis pubis. So when it will be midway between the your umbilicus and symphysis pubis, okay, midway between the umbilicus and symphysis pubis means it is, your answer would be a 16 week. Okay, your answer will be a 16 week. Okay, so when it will be at the lower border of the umbilicus, if it is lower border of the umbilicus, that is the 20 week, bacho. Okay, that is the 20 week. If the examiner asking the upper border of the umbilicus, that is the 24 week. When it will be exactly at the level of the umbilicus, that is the 22 weeks. Bacho, the examiner will confuse you here. When it will be exactly at the level of the umbilicus, that is the 22 week. Upper border of the umbilicus 24 week. Lower border of the umbilicus 20 week. Clear? So if in case the height of the uterus will be like, If in case the height of uterus will like here, this is the one third between the umbilicus and gyploid process. Okay, so this is the one third between the umbilicus and gyploid process. So this will be, yes, very importantly, 28 weeks. Okay, so this will be 28 weeks. If in case if it is two-third between the umbilicus and the gyploid process, yes, it will be 32 weeks. And at the 36 week, it will be at the level of the gyploid process. Okay, when it will be at the level of the gyploid process, bachcho, very important. So you have to consider. Okay, so there is one very important term. After the 24 weeks, the height of the uterus is equal to the period of gestation. Okay, plus or minus 2. Okay, so the height of the uterus is equal to the period of the gestation. Means the height of the uterus is one third between the umbilicus and gyploid process. Means the pregnancy will be at the week of the 34. Okay, sorry, 24. So it is almost equal after the 24 weeks. Okay, which are very important and very basic. You people have to understand related to the fundal height. Okay, so there are some nursing interventions while checking the fundal height. It is very basic and important to consider. So before checking the fundal height, okay, always ask the patient to urinate. Okay, always ask the patient to urinate and empty the bladder. Okay, empty the bladder. Very important. What is the prior? Okay, athwa before initiation of the fundal height checking procedure, what is the important thing we have to do? That is the ask the female to urinate the, and so ask the female to empty her bladder, because the distended bladder may give the false result here. Okay, so very important. So then while checking the like fundal height, so the mother should be at the flat position. Okay, the mother should be at the flat position and with the knee extended. Okay, knee extended. If she is in the late trimester of the pregnancy, okay, don't check the fundal height in the flat position, because which may lead to the supine hypotension syndrome. Okay, so at the late third trimester, okay, so the uterus will be large. So beneath the uterus, the inferior vena cava will run. So the pressure will comes on the inferior vena cava. Okay, so inferior vena cava pressure will comes, means there is no cardiac returns. No cardiac returns means it will cause the hypotension, that is the decreased BP. Okay, this is what we call a supine hypotension syndrome in the pregnancy. Okay, so after the late third trimester, so don't give the flat position. Okay, at that point of the time we can give the, yes, the pillow on the pillow below the left hip. Okay, so pillow below the right hip. Pillow below the right hip is very important to give the left lateral side position. Very importantly, you have to consider in our mind. Okay, so the primary questions they will ask here, to ask the patient to urinate just before checking the, yes, fundal height. Okay, so because the full distended bladder may give the false result. Okay, hope the concept is clear. And so here is the question is that at 36 week, where it is at the level of the symphysis pubis. Sorry, it is at the level of the G-pod process. It is at the level of the G-pod process. Option C is the correct answer. Hope the concept is clear. Okay, so where it will be. So what I told, this is the G-pod process. At the 36 week, it is at the level of the G-pod process. Hope the concept is clear, bachcho. Okay, after what height the period of gestation is equal to the height of the uterus? After the 24 centimeter, or we can say after the 24 week, the height of the uterus is equal to the period of the gestation. Bachcho, clear? Very important and very nice question. Okay, so here is the next very important question. Okay, yes, what does the Mickey Mouse sign indicate in the radiology? Okay, so you are using the radiology, that is in the pregnancy. Okay, investigation of choice in the pregnancy, or the best method of the radiological investigation in the pregnancy is the ultrasonography. Okay, so that is the USG is always best and safest investigation in the pregnancy. So you are using the USG. In the USG, okay, you found that the Mickey Mouse sign, what it indicates. Okay, what it indicates. Option A is telling that the spina bifida. Option B is telling that the hydrocephalus. Option C is telling that the duodenal atresia. Then option D is telling that the anencephaly. Okay, option D is telling that the anencephaly. What is the correct answer, bachcho? Yes, what is the correct answer for this question? Yes, Yes, almost all few of you are giving answer. That is the anencephaly. That is the correct answer. Okay. So anencephaly is the very important. Okay. So anencephaly, what happens in the anencephaly? Yes. So in the anencephaly, there is absence of the fetal cranial vault. Okay. So consider this is the fetal uh, cranium or the face. So on this one, so there is absence of the cranial vault of the fetus. Okay. So there is the absence of the cranial vault of the fetus. Okay. Fetus is having like this only. Okay. There is no head for the fetus, means there is no any top. This is what we call the cranial vault. So this is the absence of cranial vault. Okay, absence of the cranial vault. So it is very important. That is what we call the anencephaly. Okay, so this is the anterior neural pore defect. Okay, so means the anterior neural pore means it is the above neural pore. That is the defect of the above neural pore. That is called as the anencephaly. Very important. Okay, so in this one we will find the Mickey Mouse sign. What is the Mickey Mouse? Mickey Mouse is like this. This is a famous cartoon, bachon. So all of you have seen, I think so. So this is the Mickey Mouse. Okay, so in the USG, look at the USG image here. So there are large frog like eyes. Okay, so eyes are looking like a frog. Okay, and this is your, it is looking like a Mickey, right? Mickey Mouse. So this is what we call, this is what we call bachcho. So the frog eye sign or the Mickey Mouse sign, it will be seen in the anencephaly. It will be seen in the anencephaly. Okay, so what are the two important ultrasonography sign of the spina bifida? So two important USG sign in the spina bifida. We will see what are the name of the those sign. Can anyone able to answer in the comment box? So which two USG signs will be seen in the spina bifida? Okay, Bacho, in the spina bifida, yes, we are seeing the two kind of the very important sign. That is the banana sign and the lemon sign. Okay, so look at the this USG. Okay, this is the brain of the baby. Okay, this is the cerebellum. Cerebellum means that is the small little brain. Okay, that is beneath the cerebrum. This is the cerebellum backside. So that cerebellum, okay, elongated. Okay, elongated cerebellum will be there here. Elongated cerebellum. Okay, in the spina bifida, the elongated cerebellum will be seen in the USG. It looks like a banana. It looks like banana. So the banana sign is seen in the very importantly spina bifida. Okay, look at this image. Look at this image, bachcho. So here it is looking like lemon. No, it is looking like lemon. Okay, it is looking like lemon. Okay, again the lemon sign. Again the lemon sign, very importantly, that is because of the frontal boosting. Okay, that is because of the frontal boosting here. So that it looks like a lemon. Okay, here also it is a banana sign. This is the elongated cerebellum. So this is the banana sign. Okay, this is the banana sign and this one is the lemon sign. So these both are seen in the spina bifida. Okay, these both are seen in the spina bifida. Very importantly, you have to consider in your mind. Okay, yes, bacho, clear? Yes. Then what is the sign we will see in the duodenal ultrasound? We are doing the ultrasonography in the pregnancy. Okay, so we are doing the ultrasonographs in the pregnancy. Yes, so you are seeing the double bubble sign. Okay, consider this one as a double bubble sign. Okay, yes, this is the double bubble sign. Okay, this is the double bubble sign. Look at this. Look at this. So this D is the duodenum here. Okay, this D is the duodenum. This S is the stomach. Okay, this is the stomach. So here there is a two bubbles of the duodenum and stomach. It is seeing that is the, this is the double bubble sign seen in the, yes, that is the duodenal atresia. What is duodenal atresia, bachcho? Yes, all of you know, I think so. Yes, you don't know, yes, I will teach, don't worry. So this is a very important esophagus. This is the stomach. Okay, so this is the duodenum. Okay, this is the normally how it will be. Okay, this is the normally how it will be. If in case the duodenum is congenitally closed here. Okay, so this loop connection is closed here and this is a separate thing. Okay, so this duodenum is anatomic, actually it should be connected together, so but it is closed here. So closure of the any loops, closure of the any normal loops or the connection in the intrauterine life, we call this one as in the atresia. Okay, we call this one as in the atresia. Okay, so this is what we call as the duodenum atresia. Very important and very important. Okay, one more term it will come here as the stenosis. Okay, so that is the stenosis, congenital hypertrophic pyloric stenosis. Bachcho, this is the pylorus part of the stomach. Okay, what is the stenosis word? Stenosis word, it is the congenital narrowing. Okay, so it should be actually this much broad, but here in the hypertrophy of the pylorus, it will be because of the hypertrophy. Means what is hypertrophy? Hypertrophy means increased size of the cell, that is the hypertrophy. Okay, so what is hyperplasia? Increased number of cells. Okay, so that is the hyperplasia here because of the hypertrophy and hyperplasia of the pylorus. Okay, because of the hypertrophy and hyperplasia of the pylorus, especially hypertrophy of this pylorus, this loop becomes the narrow. So this is what we call as in the stenosis. Okay, stenosis means the narrowing of the lumen. Okay, options of the lumen is called atresia. Yes, narrowing of the lumen is called the stenosis. Here the duodenum is lumen is absent, so we call this one as the duodenal atresia. Here the pylorus becomes stenosis, we call this one as the congenital hypertrophic pyloric stenosis. Okay, yes, yes, the projectile vomiting, very nice. Okay, yes, it will be there. The projectile vomiting is there and it is non-bilious in nature. We will discuss while discussing the congenital hypertrophic pyloric stenosis in separately. Bachon, clear? So hope the concept is clear on this one. Yes. So this will be the sign. It will be seen in the USG in the intrauterine life. Okay, when we are having the yes, yes. So when we are having the case of the duodenal atresia, hope the concept is clear, bachon. Yes, here is the next question. So do read the question properly, perfectly, then try to give your best answer for this question. Yes, I am waiting for your answer here. Which hormone is primarily responsible for the fetal skeletal muscle development? Yes. Come on, fatafat, do comment for the yes. Do comment for the question, bachon. So which hormone is primarily responsible for the fetal skeletal muscle development? Yes. So if in case the hormone which is primarily responsible for the growth of fetus, growth of the fetus means yes the baby which is inside the intrauterine cavity, that is called as the fetus. For the growth of this fetus, the primary responsible hormone is the insulin. Okay, yes, the hormone which is responsible for the maturity of the brain is the thyroxine, and maturity of the skeletal muscle, again the answer is thyroxine. Okay, so the answer for this one is the hormone which is primarily responsible for the skeletal muscle maturity, thyroxine. Brain maturity, thyroxine. But the drug which we are using to promote the brain maturity is the MGSO4, what we have discussed in the first question itself. Okay, so magnesium sulfate is the drug to promote the brain maturity. Okay, so thyroxine is the natural hormone which is there in the fetus. Okay, which promotes the brain maturity, and it is very importantly, it is responsible for the skeletal muscle development also. There is the thyroxine. Okay, growth hormone is responsible for the growth in yes extrauterine life. Okay, after the birth of the baby, the growth hormone takes the important role for the growth of the in the extrauterine life. Okay, hope the concept is clear. Yes, what is the stress hormone? There is the cortisol. Okay, cortisol is the derivative of the glucocorticoid. Okay, so it will be released from the yes adrenaline cortex, very importantly, and this hormone is also called as the stress hormone. Okay, take a extra point. Okay, stress hormone. Already discussed a lot on cortisol in our endocrinology system. So if you are new to this channel, so do watch the endocrinology system. So in detail, everything I have dealt in the endocrinology system. Okay, including the Cushing syndrome, Cushing disease. Okay, so then comes to the diabetes, diabetic ketoacidosis. Okay, management of the diabetic ketoacidosis, hyperosmolar, like hyperglycemic, hyperosmolar, non-ketotic syndrome. Everything we have discussed in detail in the endocrinology session. Okay, so what is the uh, stunting, what is the what we call the deficiency of the thyroxine hormone in the children's. So everything we have discussed in detail in the endocrinology. Okay, there are 8 to 9 videos I think so on the endocrinology in the play store. So do watch the classes, so that is also very much helpful for you in the upcoming exams. Okay, so hope the session we have conducted is helpful for you all. Okay, if anyone is new to the channel, so do subscribe to the channel. Okay, so and we have the Telegram group as well, so do join to our Telegram group. So where I will be posting the practical questions. Okay, so that is helpful for you all in the upcoming future exams. Okay, so we'll meet again in the next class, students. Once again, happy new year to you all. Okay, so God will grace with the good strength, prosperity, health, wealth, everything what you will deserve in your life. Okay, so thank you so much. We'll meet again in the next session. तब तक के लिए जय हिंद, जय भारत.